Hi, good afternoon, everyone. It's now 12 o'clock or 12:01 by my clock, and this is Carol Holmes at the RNAO Home Office. I'd like to welcome you to today's webinar on the Long-Term Care Best Practice Spotlight Organization. Now, just a couple of things before we actually begin. We are going to be recording the session today so that we can save it for others who aren't able to join one of the two webinars that we're providing on this topic. So in order to do that, I'm going to be muting your lines until such time as we open things up for questions. So I'm going to mute the lines now.
The conference has been muted. La conférence a été mise en mode discrétion.
So once again, welcome to today's webinar, and I have with me Heather McConnell, who is the Associate Director of, for Guideline Implementation and Knowledge Transfer at RNAO at the Home Office, and you'll see our pictures on this screen. And again, I'm Carol Holmes. I'm the Program Manager for the Long-Term Care Best Practices Program. So today for the webinar, we're using WebEx, and a couple of features that are important for you to know about. You'll see names of participants in the participant panel on the screen, and there's also a question and answer panel that you can use if you'd like to communicate with us through the WebEx technology. And as I said earlier, we'll open up the phone lines later on towards the end of the presentation for questions and that you may have or comments that you wish to share with us. So for today's presentation, we're going to talk about a number of things. First of all, we're going to describe the Best Practice Spotlight Organization designation program and talk about the process for becoming a long-term care BPSO. We'll also be reviewing the eligibility requirements for organizations that are interested in applying for the long-term care BPSO designation. And we have with us a representative from one of the current long-term care BPSOs. We have Teresa Thibault with us today from Parkview Manor in Chesley, Ontario, and Teresa will be sharing some information about her experience in the role of the BPSO liaison and also in a leadership role at Parkview Manor and their experience as a long-term care BPSO. We'll discuss the long-term care BPSO pre-designation deliverables, and we'll also talk with you about the supports that RNAO provides for you to engage in this with us. And then, as I said earlier, we'll have time for questions and discussion. So a little bit about RNAO. As many of you probably know, we are the professional association for registered nurses, nurse practitioners, and nursing students in Ontario. And we provide a strong and credible voice leading the nursing profession to influence and promote healthy public policy and clinical excellence in practice. And the Best Practice Guidelines program is a signature program of RNAO. The International Affairs and Best Practice Guidelines Center is a component of RNAO and oversees the work of the development of best practice guidelines, their dissemination, and we work to actually actively support the uptake of evidence-based clinical and healthy work environment best practice guidelines, and as well evaluate their impact on patients, residents, organizations, and health system outcomes overall. So a little bit about the Guidelines Center and the processes we have in place. So we have a rigorous process for developing best practice guidelines And it begins when a topic is selected and we bring together a panel of experts who have expertise in the area that's being developed. We bring them together, and at RNAO, we conduct a systematic review of the research literature that informs that topic, and we have a group of nursing research associates that contribute to that and bring that literature review forward to the guideline panel. Recommendations from that systematic review are formulated. Stakeholders are then engaged once there is a final draft of the guideline for review. So we put out a request to stakeholders to be involved in reviewing that particular guideline, any particular guideline that we have under development. And then that review process is incorporated into the final version of the guideline before publication. And we have a 5-year period of time for the review of our best practice guidelines. So once a guideline is published, we move on to disseminating it and engaging others in actually using it. And so that's one of the key things that is a component of the Best Practice Spotlight Organization designation, is to actually use our guidelines, to implement them, to sustain their use in practice, and then move on to evaluating the outcomes that are seen through the use of those guidelines. So today, through our discussion about deliverables for the long-term care BPSO, we're going to be talking about the important role of champions in being engaged in actually using and leading the use of guidelines in practice, the Advanced Clinical Practice Fellowship Program that further supports the use of best practice guidelines, and other areas of inquiry related to clinical practice, and then other supports such as nursing order sets, workshops, conferences, institutes, our website, and so forth, and the e-learnings that actually support the use of guidelines as well. So all of those things we'll be reviewing briefly with you today. And then we move on to considering evaluation and monitoring of the use of guidelines, and of particular importance for best practice spotlight organizations is NQuire. And Heather will be talking with you further about that today. Of course, quality improvement approaches, outcome indicators, and research methodology also informs the evaluation and monitoring of best practice guidelines. And then overall, this is to have an impact, a positive impact, of course, on patients, clients, residents, providers, organizations, and the healthcare system overall. So a few words about the Long-Term Care Best Practices Program, and I'm sure many of you are already familiar with the program. We've taken on a mission to enhance the quality of care for residents in long-term care by working with you to create a culture of evidence-based practice and supporting staff working in long-term care homes to use RNAO's best practice guidelines. And the program is funded, as is all of the best practice guideline development work, by the Ministry of Health and Long-Term Care. So a little bit more detail about RNAO's BPG implementation methodology. We do this at an individual level through things that I've mentioned earlier about developing champions, the Advanced Clinical Practice Fellowship. There are nursing order sets. We have RNAO, an RNAO community related to a variety of topics, and we have one specifically established for best practice spotlight organizations, and then all of the professional development offerings that we have available. At the organizational level, we have the best practice spotlight organization designation. And then at the system level, we have implementation projects and initiatives and programs like the Long-Term Care Best Practices Program. Just trying to move the slide ahead.
Yes.
Oh. There we go. All right. On to a little bit more about organizational implementation. And so I mentioned that the best practice spotlight organization approach is a key organizational implementation approach we have at RNAO, with the goal of influencing the uptake of best practice guidelines across all healthcare organizations and enabling practice excellence and positive client outcomes. Here we go. So the best practice spotlight organization pre-designation and designation involves organizations partnering with RNAO to implement multiple best practice guidelines over a 3-year period, which is the pre-designation period, and then attaining the BPSO designation once all of the deliverables are met. So as you know, there's an application process, and that results in organizations being considered to be best practice spotlight organizations, and a formal partnership for those that are successful results from that. Within this process, we have specific requirements for the systematic implementation of select RNAO best practice guidelines, the development of an infrastructure within the organization that will support that work, reporting mechanisms, and a whole process around knowledge exchange so that we can learn together and support organizations that are involved in this program. There's approaches to planning for sustainability of the use of guidelines, and then spreading the use of those guidelines, measuring outcomes through the selection of standard indicators, and we'll talk more about that later. Once organizations are designated best practice spotlight organizations, there's continued expansion, spread, and sustained use of the BPGs, as well as taking on the implementation of additional BPGs. There are mentoring opportunities and continued measurement of outcomes. So around the world, there are a number of countries and locations where there are best practice spotlight organizations, and this map shows you those areas, including those that take on a host model and those that are individual best practice spotlight organizations. So we have a number of countries currently in progress that you can see on the screen. In Chile, where they're preparing a host model. There's a process underway in Uruguay, in Portugal, in Italy, and Malawi. So, and you can see that there are best practice spotlight organizations in Jamaica, in Colombia, in Chile, in Belgium, in Spain, China, South Africa, and Australia. And then, of course, all of those that are in Canada. So we have 94 BPSOs representing over 450 healthcare and academic organizations around the world. So what's the long-term care BPSO designation all about? Well, I spoke earlier about long-term care homes and organizations partnering with RNAO, and that's done to create evidence-based cultures within those organizations through the systematic implementation of multiple RNAO BPGs. And this is achieved through a number of approaches, which include establishing dynamic and long-term partnerships that will positively impact resident care through supporting knowledge-based nursing practice. Demonstrating creative and contextualized strategies. And what that means is those strategies that work within particular organizations that can successfully take an approach to implementing nursing best practice guidelines both at the individual level and organizational level of those organizations that join in with us. Establishing and using effective approaches to evaluate BPGs, specifically in long-term care, using appropriate structure, process, and outcome indicators, and identifying effective strategies for system-wide dissemination of guideline implementation and the outcomes that are particular to long-term care. So I'll tell you a little bit about the current BPSOs that we have in place. So in 2014, we launched our first designation specifically for long-term care homes in Ontario. And it's hard to believe that now we're approaching the end of that 3-year period. So we have 3 long-term care organizations involved. As I mentioned earlier, Parkview Manor Healthcare Centre in Chesley, Ontario. And today you'll hear about their experience. We have St. Peter's Residence at Shadoke in Hamilton, and the Region of Peel long-term care homes that are in Brampton, Mississauga, and Caledon, Ontario. And the Region of Peel has 5 long-term care homes, and they are all engaged with us in this cohort. Going on to 2015, we did another call for proposals, and we were successful in including Pioneer Ridge Home for the Aged in Thunder Bay, Ontario, and Bruyere Continuing Care, specifically the St. Louis Residence in Ottawa, Ontario, and Orleans. And they're currently in their 2nd year of the pre-designation. Then in this year, I should say, it was last year that we launched the call for proposals. This year we had our most prolific groups join us, largest cohort by far, and there's 2 slides, in fact, to list all of their names, but I'll start with those that are here. The Grove Park Home in Barrie, Ontario. St. Joseph's Life Care Centre is the lead home for the St. Joseph's group that includes St. Joseph's Villa in Dundas and the St. Joseph's Health Care Centre in Guelph, so a 3-site organization. The Pearlie and Rideau Veterans Health Centre in Ottawa, Ontario, and the Halton Region Long-Term Care Homes. The 3 homes that are listed here in Halton Region are Allendale, Creekway Village, and the Post Inn Village. And then in addition to them, we have the Niagara region. We have 3 of their 8 long-term care homes participating in the pre-designation work, the Rapple J Lodge, Woodlands of Sunset, and Deer Park Villa, all in the Niagara region. Tilbury Manor Nursing Home, which is located in Tilbury, Ontario. The William A. George Extended Care Facility up in Sioux Lookout has LTCAP beds incorporated within their organization, and they're participating. And we have Woodingford Lodge in Woodstock, Ingersoll, and Tillsonburg, so all 3 of the Woodingford Lodge sites, which is part of Oxford County. So we're now at our 4th call, our 4th request for proposals for 2017 to 2020. And so this request for proposals is exclusive to Ontario long-term care homes and organizations that wish to apply and select and support, and we will select and support a new cohort of long-term care BPSOs. And successful applicants will initially enter into the 3-year agreement with RNAO from 2017 to 2020, which is the pre-designation period. So I'm going to talk a little bit about the eligibility criteria, and then we'll move on to hear from Teresa regarding Parkview Manor's experience. So we have a number of eligibility criteria for you to consider. So homes that are eligible to apply to consider the following criteria: that demonstrated commitment to evidence-based practice, demonstrated through previous implementation of one or more of RNAO's clinical nursing best practice guidelines. Organizations that have supported staff to participate in opportunities to develop capacity with respect to evidence-based practice, such as participating in our Champions Network through the Advanced Clinical Practice Fellowship, attendance at RNAO Learning Institutes, or long-term care sector-specific provincial quality improvement capacity building initiatives, of which there are a number of those. In addition to that, having a senior nurse leader in the role of either administrator, director of care, or the equivalent position to that, who is a member of the senior management team of the organization. We need to hear that there's a strong and explicit support from the board governing the organization as applicable, the senior management team, the senior nurse leader, clinical nursing staff, union, and other key stakeholders that would be supporting evidence-based practice and demonstrating support for the nursing profession within the organization and the implementation of the best practice guidelines that are selected. That there's an organizational vision, mission that provides an opportunity to leverage other initiatives that are related to evidence-based practice and resident safety. That there's the capacity to actually implement, monitor, and evaluate the nursing best practice guidelines that are selected using the NQuire indicators. And as I said, you'll hear more about this later when Heather talks about deliverables and such. And that you collect and submit actual data related to nursing practice, resident outcomes, organizational human resource structure indicators that will be a baseline prior to implementation, and that at regular intervals during the implementation period. There's the capacity to allocate an individual who would be a registered nursing staff member in a leadership role within the organization, who will serve as the BPSO liaison and will be a key contact for us to work with the RNAO long-term care BPSO coach, who is one of the best practice coordinators within our program, and together they will work together to support guideline implementation, evaluation, and sustainability. A demonstrated ability to engage in successful partnerships that may have taken place in other venues and with other groups that would demonstrate the ability to be able to engage in a partnership and achieve outcomes through that. Capacity and commitment to meet the requirements of the terms and conditions of the BPSO designation, which is the period of time following the 3-year pre-designation period, in order to maintain the designation and sustain the implementation of best practice guidelines. And that's renewable every 2 years, assuming that the terms and conditions of the deliverables are met. And so now I'm going to turn things over to Teresa Thibault. So to be able to do that, I need to unmute the participant lines. So I'll just do that now.
The conference has been unmuted. Le mode discrétion a été enlevé de la conférence.
So Teresa, I'm going to turn things over to you now. And Teresa Thibault has many roles, as you can see, at Parkview Manor in Chesley. So The capacity in which she's speaking with us all today is her role as the BPSO liaison for Parkview Manor. So, Teresa, I'll turn it over to you and invite you to speak about Parkview Manor, the information that's here on the slide, and also to share some highlights of your experience as an organization participating in the Long-Term Care Best Practice Spotlight organization.
Wonderful. Thanks, Carol. I'm here. Thanks for having me today. So I am an RPN, the quality coordinator, staff educator, BPSO liaison. I'm the BSO lead. I'm the infection control backup. I just wear a lot of hats here. But one of the ones in the forefront right now is being the BPSO liaison. We are a small 34-bed home in rural Ontario. We have about 50 staff. We are owned by Southbridge and managed by Extended Care Assist. So I'm just going to start off with how we got started. We noted a concern in 2013 over the number of falls that we were having each month. We went from having 20 or more falls a month to as few as 2 by the end of implementing the Preventing Falls BPG, and we were able to sustain that success and have gone on to even have as few as 0 falls in a month. So this really got me as a person pumped up and excited, understanding that these best practice guidelines, there must be something to this if we can have this much success. And so we didn't ask for help, didn't really know, I suppose, at the time that we could ask for help. So it just showed that these best practice guidelines really do lay it all out there for you, even without going to RNAO and asking for help. So in 2014, the request for proposal came out, and I was extremely keen and interested after having such success with that first BPG. The RFP, it certainly does take a lot of prep, and you need everyone on board with this idea. Have meetings with your staff, the residents, families, talk about this possibility at any quality council meetings you have. You need your medical director's support, allied health professionals, and anyone else who's already in your corner and has seen firsthand you and your facility's potential. So any other people that can be involved that would support you in this, if you can get letters of recommendation from them, it's really helpful for your RFP. For me, I'm quite sure management was supporting me, but thinking, yeah, okay, Teresa, good luck with that one. We, as I said, had no ties to RNAO, and we're a rural home with few staff. So sort of my own tagline is dream big. If you have a dream that doesn't scare you, you don't have a big enough dream. And that really just sums up the long-term care BPSO journey. So looking at the RFP, I looked at the BPGs and then critically at our home to see which BPGs could make the biggest impact on the lives of our residents. Something to consider is how can the chosen BPGs make an impact on your quality improvement work and meeting your quality protocols and goals. So we actually chose 5 BPGs, which was more than we needed to, but we chose person and family-centered care, preventing and addressing abuse and neglect, promoting continence using prompted voiding, preventing constipation in the older adults, and assessment and management of pain. Behind-the-scenes work with implementation plans are done by the BPSO working group in our home. It's a multidisciplinary group of like-minded staff who are passionate about creating positive change. We meet monthly. They're the driving force behind the change, and they're key for peer-to-peer learning. They help with education and celebration. They bring back to the table what exactly is going on the floor with the staff. I'm not sure if I'll talk about this later, but I just want to slip this in that our working group is multidisciplinary, but to the extent that we have our director of care, I've got myself and another RPN, 2 PSWs, and a housekeeper. And so it's a really great mix, and you get sort of perspectives from a lot of the different departments. It's really a good mix for us. So about our chosen BPGs, person and family-centered care as well as abuse and neglect don't provide you with tangible outcomes. They're very difficult to measure in terms of successful implementation, but they really do lay the groundwork or the foundation for the work to be done in the future BPGs, and they set the tone for the culture of the home. We created a policy specific to expectations of providing person and family-centered care, as well as a policy just in general about the use of best practice. So these are internal policies that are used in our orientation with staff performance appraisals and disciplinary purposes. So talking about BPSO and what we're doing in the home is something that we talk about in interviews as well. So for person and family-centered care, we audit the nurses' notes monthly and do pop quizzes occasionally. We have My 5 Things, which is just helping us understand our residents a little bit better. So we ask a person their 5 favorite things and their 5 least favorite things, and that's posted for all staff to see in the residence room. So it gives them a better idea of what to even start a conversation about. And then we created the Getting to Know You questionnaire, which goes a little bit deeper and helps us understand a person's goals and a little bit more about their own culture. And we also do a 5-question resident survey semi-annually. And so this was created to fill in the gaps from the corporate survey that we use, because we, again, want to know more of the nitty-gritty details and how are we really doing. So that's been a good success for us as well. For the abuse BPG, this one, I mean, just the topic of it really makes people squirm. We want to focus on the more subtle sides of abuse and neglect that may be overlooked or underreported. The focus for this BPG was really just educate, educate, educate. We provided resources of where to go for help and helping staff understand why abuse or neglect happens, what can be done to prevent it, helping them find supports and practice self-care, understanding that it is really okay to ask for a break or an assignment change. We know that permanent assignments are good, but to a point. If you have residents that are very, very challenging in your section, then it's not always the ideal situation for that individual. So probably our biggest milestone was we created abuse and neglect videos and a discussion guide to go with that. So that was in partnership with RNAO and some government funding as well. These videos were created as a toolkit to help us educate staff in a way that they could really sort of sink their teeth in. They could really understand, because it was scenario-based on what they might see in their long-term care homes. And the discussion guide is a really important tool in that it helps the educator explain all sides of the abuse and, again, sort of where to go for help. These videos and the discussion guide are available worldwide now on YouTube and the RNAO website as part of their Preventing and Addressing Abuse and Neglect Toolkit. So that's probably our biggest feat in this BPSO work. For continence, we're doing the prompted voiding, and it's been a real learning curve, and it has taken time for staff to see the benefits. We have 3 residents on prompted voiding plans, and they're doing very, very well, and we've been able to decrease the frequency of their incontinence. This BPG requires follow-up and reminders to staff and clear expectations of documentation. But it is one that's more tangible. You can actually see some results there. Constipation, this is probably the most tangible BPG that we've done. We created new medical directives specifically to the bowels. It's individualized to a person's specific needs and preferences. The focus now is on nutritional interventions first and decreasing the amount of medicinal interventions that we use. It's been a great opportunity for dietary and nursing to work together towards a common goal, and we've involved the dietitian as well as restorative care. We created a new admission tool to supplement the tool used on point-click care, which digs a little deeper into a person's individual bowel habits and what works for them. And briefly on pain, we're working with our pain and symptom management team in our region to bring in quality education to our staff. This BPG is a lot about communication between nursing and PSWs. That's sort of our focus. And a big portion of this BPG is advocacy and learning how to do this. It's a real skill, how to advocate, regardless of what position you hold in the home. So quickly moving on to quality improvement here, the work with the BPSO has helped us engage clinicians and leadership team. So we really have some key leadership roles now in the BPSO team. As I said, there's that multidisciplinary team that works together and meets once a month. And we have the opportunity and expectation to share our successes both locally, regionally, and provincially, which has been a real honor. Resident engagement, we engage the staff and families every step of the way. We're sharing our plans with our presentations. Our resident survey, as I said from head office, didn't include specifics that we want to know more about. Our residents are now able to have their voices heard on some more specific issues. And it's a way for them to provide feedback for us, and it also helps us with our reports to RNAO. Parkview's vision, Parkview as a home has adopted the vision from our BPSO team. So now our vision is that residents are experts in their lives. Let them lead the way. I just want to finish by talking about the spin-offs of this work. The spin-offs from the long-term care BPSO has just been incredible. I am so pleased to say that I'm part of a steering committee for what we call the Grey Bruce Nursing Network, and that's been going on for the last 2.5 years, and that is thanks to RNAO and the BPSO program. We have a group of nurses from many sectors coming together to influence practice and policy change in our own region, and none of that would have been happening without the BPSOs. We provide education for all sectors once a year focused on spreading the work of best practice. Over 80 nurses attended one of our RNAO open houses and couldn't say enough about it. We have a website in the works that will be a resource for information sharing and a place where nurses can ask each other questions about implementation and sustainability of evidence-based practice. The passion and drive that you see in this group is inspiring. The biggest benefit for me has been working with other homes and organizations. If you really want to share your success and help others, there's endless opportunities. The connections you will make will open opportunities you never dreamt were possible. If you're looking to make positive change in your home and you're not afraid of hard work and a challenge, this opportunity is for you. RNAO has the tools you need to succeed. The long-term care toolkit is very helpful, and so is your long-term care BPSO coach. She's a wealth of knowledge and can provide you with all kinds of resources and help you every step of the way. The RNAO staff have been phenomenal, so very helpful. It's like you have your own cheerleaders. They really want to see you succeed, and it's evident with every interaction. I think I've hit my time there, so I am going to stay on the call. If there's any questions, I'm here to answer them. Thank you for having me.
Teresa, thank you so much for joining us today and giving such a comprehensive overview of your experience over the past now 2.5 years as a long-term care BPSO and the liaison in that role, and certainly what you've achieved through the leadership that you provide is tremendous. And so we really appreciate your sharing all of those positive messages with everyone. And thank you for joining us today. We will invite you to stay with us. There may be questions towards the end. So now I'm going to turn things over to Heather, who will talk about the deliverables.
Great. Thanks so much, Carol. And again, thank you so much, Teresa, for joining us today, and to all of you on the line. There are a number of deliverables for the long-term care BPSO program, and I'm going to go through them sort of in categories, but please do reference back to the RFP itself because they are all outlined there. But really the focus for this requirement is that you're really going to be engaging in a 3-year partnership with RNAO. And that 3-year partnership is actually renewed annually, and it's reviewed and renewed annually, provided that certain criteria are met. So you have opportunities on an annual basis to see how things are progressing and renew your pre-designation agreement over that 3-year period. And of course, we're also recognizing that there is a need on the part of the long-term care BPSOs to contribute the necessary financial resources to support guideline implementation, evaluation, and sustainability, not only during that initial 3-year pre-designation period, but also ongoing as a long-term care BPSO designate. Now, this is a long list of guidelines that are available to you to select from for implementation. They're listed on page 5 and 6 of the RFP itself. But the requirement really is that you implement a minimum of 3, implement or expand the implementation of a minimum of 3 RNAO clinical best practice guidelines. And you heard from Teresa that their organization actually selected 5, but 3 is the minimum. There is a certain requirement, an expectation that one of those 3 must be implemented across the entire long-term care home, while the others could be implemented either across the entire home or might be more specific to certain programs or units. And we've certainly seen combinations of that with all of our long-term care BPSOs. We are expecting that all of the guidelines would be implemented by the end of the 2nd year of that 3-year pre-designation period. So that really leaves year 3 for a focus on evaluation, sustaining the improvements, and really integrating the work in preparation for long-term care BPSO designation. For those of you that come from long-term care homes with multiple sites, and you saw our list of sites that are participating, some do have more than one site, and it's up to you how you decide how to structure your work. You can select one site to initiate the BPSO work within your collective and plan to spread to the other sites once you are designated as a long-term BPSO, or you can conduct the long-term care BPSO work across the entire organization at all sites. And if this is the choice that you make, then the guideline that you must implement across the long-term care home must be implemented at all sites. So I can give you the example of our current group, one of our current BPSOs, the Region of Peel. They are implementing one guideline across all 5 homes that are participating in the long-term care BPSO program, and then the other 2 are very focused on one of the long-term care homes within their collective. There is some priority given to those guidelines that reflect one or more of the required programs that are outlined in the Act and the regulations. And again, the list of those are included here as well as in the RFP. Now, in terms of implementation, we are encouraging the utilization of nursing order sets within your electronic medical record system for, at minimum, the guidelines are recommending at least those guidelines being implemented across the entire organization, so that if you are using one or are focusing on the implementation of guideline across multiple sites or across your entire home, that would be a logical one to introduce nursing order sets. And there's certainly more information about nursing order sets on the RNAO website. Another requirement is to focus on establishing a critical mass of best practice champions. And what we're recommending and requiring is that there be 15% of caregiving and management staff, which can be a combination of regulated and non-regulated staff, as best practice champions over the 3-year partnership period. And you'll note that we've set some specific targets for recruitment and engagement of champions over that 3-year period, so that by the end of 3 years, you'll have a total of 15. We're also, as part of implementation and to build capacity, requiring that a minimum of 1 registered nurse or registered practical nurse be sent to the annual RNAO Clinical Best Practice Guidelines Summer Institute. And that will be funded through the Ministry of Health and Long-Term Care in terms of their travel and registration fees for that particular professional development event. But the focus of this institute is actually on guideline implementation, and so we have found, working with our BPSOs, this is a really key strategy to help prepare those leading best practice implementation now and into the future. And also, we're expecting that you'd submit a minimum of 1 proposal over the span of the 3-year pre-designation period for a registered nurse to participate in the RNAO Advanced Clinical Practice Fellowship Program. And again, if you're not familiar with this program, there's much more information available on the RNAO website. And again, this is a program that's funded through the Ministry of Health and Long-Term Care. In order to keep track of your champions and your institute attendees and those who have been participating in the Advanced Clinical Practice Fellowship Program, we'd expect that you have a mechanism of tracking who those individuals are and looking for opportunities to support them with knowledge exchange. And of course, there's expectation that you'd be able to attend the long-term care BPSO orientation if you had a successful proposal. And we have an annual BPSO knowledge exchange symposium for all of our BPSOs. Usually have about 150 to 200 people in attendance, and we'd be expecting that 2 staff from each of our long-term care BPSOs would be in attendance at that as well. One of the critical things that we've identified for success is that there be an infrastructure within the organizations that are participating in the BPSO program that really includes a steering committee or some group that's responsible for monitoring the implementation activities, the sustainability and spread activities, ensuring that the deliverables for BPSO are met and reported to within the organization to an accountability framework. So that's something that you'll absolutely need to consider and think about. And of course, committing to work with an RNAO long-term care best practice coordinator, and Carol mentioned this earlier, one of our coordinators, our staff, will act as a dedicated coach to the BPSO during that 3-year pre-designation period. And this coach won't be active part of a working team, implementation team, but will really provide their support through a consultative and coaching model. What you'll need to do is be able to identify a BPSO liaison, a regulated nursing staff member, as Carol mentioned earlier, to really coordinate the implementation and evaluation activities and be the key person to liaise with us here at the RNAO. And certainly Teresa described her role quite beautifully in terms of the range of activities that involves. And also commit to working with the BPSO designate mentor organization as appropriate. And certainly as we're gaining more and more long-term care BPSOs within our group, opportunities for mentorship are growing. We'd also expect that there's opportunities for you to develop a sustainability plan so that after the 3-year pre-designation period, that there's opportunities to really continue this work and that you have a plan in place to support that in the go forward. Now, the next section is really about research and evaluation, and we've been talking about NQUIRE, and NQUIRE stands for Nursing Quality Indicators for Reporting and Evaluation. And the vision of NQUIRE is really to improve quality health care through the use of nurse-sensitive indicators based on the implementation of RNAO clinical best practice guidelines to impact practice, management and policy decisions, education, and health systems research. And so the key features of NQUIRE are such that it is actually an international data system of quality indicators. That map that Carol showed you earlier in the presentation reflects all of our BPSOs, and all of our international BPSOs, as well as those here in Canada, are submitting data to NQUIRE. The indicators come from the practice recommendations with RNAO's clinical guidelines. They also reflect human resource process and outcomes of care arising from guideline implementation. And as I mentioned, they're collected at this point exclusively by our BPSOs. And this participation in NQUIRE allows for the collection, analysis, and reporting of comparative indicator data. And really what we're wanting to do is evaluate the outcomes of guideline implementation in our BPSOs across all sectors. Give me a moment here to advance the slide. There we go. So here's a bit of an illustration here for you. You can see the clinical BPGs on the left-hand side. The human resource indicators are common for all guidelines, but the process and outcome indicators are very specific to the clinical BPGs that you're selecting for implementation. And again, focusing on nursing care and client outcomes are specific to the guideline practice recommendations. You'll note that on page 5 and 6 with the list of the guidelines to select from, there are a few guidelines that we have included on that list for which NQUIRE indicators are pending, and so they're currently under development. So we've already talked about this in terms of we'll provide data collection requirements and tools via NQUIRE for the quality indicators that you choose to monitor and evaluate. And the data collected won't include any individual resident identifiers at all, but will be aggregated to really focus on the impact of clinical guidelines on resident outcomes in nursing practice. There is an expectation that you'll select a minimum of one human resource structure indicator to submit data on, and these are all listed on page 8 and 9 of the RFP, and I've included the definitions here. And we would expect that as you're submitting a proposal that you will have identified which one of these you'll be able to submit data on. We've talked a bit about NQUIRE now, but there is expectations that you would continue with your regular quality monitoring activities that are in place within your organization, that you take advantage of opportunities to participate in research projects that come our way, and certainly we'll let you know about those and offer their opportunity for you to participate should you wish to. And also we'd encourage you to become a member of the Nursing Best Practice Research Center, which really provides opportunities to link with researchers and others related to evidence-based practice and guideline implementation. Now, once the guidelines are all implemented and you've been working away in this area for a bit of time, there'll be opportunities for you to share learnings and resources developed and achievements with the long-term care sector and the wider healthcare community. And we've provided several different options to you in terms of ways in which you might consider disseminating your work. And certainly Teresa shared with you their experience of being able to share and disseminate the work and the videos and the discussion guide that they created on focusing on elder abuse prevention, which is actually now being translated into French. Another requirement is the minimum of development of a manuscript and submission of a manuscript for publication in a peer-reviewed or non-peer-reviewed journal, and by the end of the 3-year pre-designated period. And again, this is really a deliverable that's helping us move forward with the literature to support the work that we're doing together and really ensure that our messages and the successes that you're having as BPSOs are out in the healthcare community. Also, inclusion of a BPSO website on your long-term care home's website or page on the website, and utilizing the BPSO logo that we'll provide and including that on any relevant work in terms of being able to acknowledge your BPSO status. And of course, at the end of the 3-year pre-designation period, and assuming all deliverables are met, the organization will receive a designation as a long-term care BPSO and will become one of our designate organizations. And that designation is renewable every 2 years. And organizations are expected to continue to sustain and spread guideline activity during those post-designation years. And again, as I mentioned earlier, for those homes that might have multiple sites and you've selected one to start your work with, the expectation would be that you would spread the best practices implemented during the pre-designation period to the remainder of the homes within your collective. Well, the screen seems to have gone blank here, but that's okay. I'll just get the slides back up again. So some of the things that RNAO will commit to work is that we'll provide all of our BPSO organizations with access to all of our published guidelines and resources. We'll provide an orientation to the initiative that will be funded by the RNAO through the Ministry of Health and Long-Term Care, with specific guidelines selected and implementation resources. We'll provide expert consultation on guideline implementation and uptake through the support of the Long-Term Care Best Practice Coordinator in the role of the Long-Term Care Coach, and that's equivalent to about 1 day per week or 0.2 FTEs during the 3-year pre-designation period. And we've seen combinations of ways in which that support's provided. Sometimes that'll be in person, sometimes virtually, et cetera. It's really dependent on what works best for all parties involved. We'll also commit to supporting the development of a Champions Network for you, and certainly through the Champions Network, our Clinical BPG Institute, and the provision of financial support for the registration and travel costs through funding from the Ministry of Health and Long-Term Care, as I mentioned previously. The Nursing Order Set Library via the Nursing Order Set website. And there's also the development underway of an implementation guide for point-of-care users to facilitate technology-enabled BPG implementation. So again, you can find out more about nursing order sets on the RNAO website. Another big part of the work that we're doing is really about capacity building, and so we've developed and commit to continue a network of long-term care BPSO liaisons, and we meet monthly with that group for the purposes of knowledge transfer and exchange through regular teleconferences and meetings and other types of events that I've mentioned previously. And again, we'll host an annual BPSO symposium that will bring together people from all across the province and internationally to support you in this work. We'll meet on a biannual basis via teleconference with each long-term care BPSO to review your reports and monitor your progress and provide recommendations and ongoing support. We'll look at providing site visits over the 3-year period, and this would be not in addition to those site visits, of course, that your BPSO coach is involved with. Again, we've talked about the role of the coach, so I think that's addressed that. And thank you, Sitlali, for getting the slides back up and running again. We've talked a little bit already about Enquire and the resources that we'll be providing to you as long-term care BPSOs related to Enquire. And we'll also look at funding. Now, this is where the funds that we're able to provide come from the Ministry of Health and Long-Term Care, as I mentioned previously. That will provide the support from the BPSO coach, travel and accommodation for the orientation launch, the Clinical Summer Institute, our annual BPSO Knowledge Exchange Symposium. So, again, those are supports that are provided with the funding that we get from the Ministry of Health and Long-Term Care. So the proposal evaluation, there's a variety, and this is outlined in the actual RFP itself, but just wanted to draw to your attention that the proposal evaluation has a range of weighting for the different sections of the proposal that range from 10% to 20% of the total value of the RFP or the proposal that you're submitting. We will have and do have a long-term care BPSO review committee, so each proposal will be reviewed by multiple individuals with different perspectives that they bring for their expertise to the table in terms of the review process. Successful applicants will be identified in the goal of selecting one within each of the LINs that we have depending on the submission distribution. And we will inform applicants in the writing of the status of their applications. So I just want to highlight some important dates. So October the 6th was the release of our RFP, and we know that you've received it because you're here on the call with us today. November the 14th is the deadline for the letters of intent. So this is just an email that we need to receive by November 14th to indicate that you are interested in planning to submit a proposal. Once we receive the submission interest from you, then we will be able to release to you the details of the online submission form. So the online submission form is based on the RFP that you have currently available to you, but will be some specific questions that you'll need to respond to in order to be able to submit online. The RFP deadline will be December the 7th. We'll release the results in February, March, and we'll be looking at having a long-term care BPSO launch. I'm not sure it's going to be the 1st of April, but it will be early in April 2017. So we've got a few minutes left, just a few minutes left, but I would like to offer the opportunity for any questions if anybody on the line has some questions for myself, Carol, or for Teresa. Any questions for anybody? If you do have any formal questions once you get into the process of writing your RFP, anything specific that you want responded to by us, we do expect and will require, this is outlined in the RFP, that we must receive written questions that we will respond to by email no later than December the 1st, 2016. And you can submit them to that email address that is visible on the slide, and it's the same one that's included in the RFP, and they'll be sent to my attention so that we can respond to them appropriately. I'm just going to call one more time to see if anybody on the line has any questions that they'd like anything clarified or have any specifics that they'd like to discuss at this point in time. Well, hearing none, I'll call a close to our time together then. I see there's a few people that have been using the chat box and have got some of their answers that they were questioning about, so that's great to see. But by all means, please do feel free, if you do have questions or want more have anything that needs to be clarified, you can contact us at that email address that we've shared with you previously. We're quite happy to respond to any of your questions and queries, and we will be hosting another information session next Thursday from 1 until 2 o'clock if you're interested in joining us again, or if any of your colleagues weren't able to join us today. We will be archiving this particular art and access at a future time. So again, thank you very much for your interest today and your interest in the long-term care BPSO program. Bye for now.